A new Cleveland Clinic study found that having a history of COVID-19 can double a person's long-term risk for heart attack, stroke, and even death. Doctors say they also discovered the long-term risk for cardiac issues increased if the person was hospitalized for COVID. In fact, their risk was comparable to someone who had a heart attack before. So what does all this mean? The findings emphasize the importance of talking with your physician about heart health. More specifically, what you can do to lower your risk for cardiovascular disease. As for why COVID seems to be causing potential heart issues, doctors say they're not entirely sure. However, they did discover that blood type could also play a role.
So everyone after COVID in general had a higher risk, but amongst those who had an A, B, or AB blood type were at especially high risk compared to those with an O blood type. And there have been small but other studies that have suggested the ABO blood type is linked to future cardiac events and development of heart attack and stroke. So whatever that pathway, how that is linked to cardiac events, COVID is somehow tagging along with that pathway, but we don't quite understand how blood type is linked to heart disease.
The Cleveland Clinic also worked with the University of Southern California researchers on this study. Together, they analyzed data from the UK Biobank, which looked at individuals who first contracted COVID in 2020 before the vaccine was available. Speaking of the vaccine, Dr. Hayes encourages the public to continue getting vaccinated to prevent severe infection.